the Secretary to the Government of Federation, Honorable Ministers, Directors here present, ladies and gentlemen, I want to build on what the Secretary to the Government has so eloquently put forward and put the point of the Ministry of Health forward. First of all, the situation report. As of today, the 10th of April 2020, Nigeria has recorded 288 confirmed COVID-19 cases, of which there are 14 confirmed cases, 13 from Lagos and 1 from Delta. This increase is due to the diligence in tracing and testing, which is ongoing. I believe there is a backlog that is being picked up here. But Lagos remains the epicenter with 158 cases, and FCT has 54 cases. The third is in Osun, 12 in Edo. Osun is 20, 11 in Oyo, 8 in Bauchi, 5 each in Akwa Ibom, Kaduna, 4 in Ogun, 2 in Delta, and 1 each in Benue, Katsina, and Ondo. The Federal Ministry of Health, through the Center for Disease Control, is increasing testing capacity continuously. And as of today, we have about 10 laboratories capable of testing COVID-19. We have 2 in Abuja, the National Reference Laboratory in Gadua, and the Defense Reference Laboratory in Mogadishu, Abuja. We have 3 in Lagos, appropriately because of the cases they have. And they are the laboratory in Luth, the Lagos State Biosafety Level 3 Laboratory, and the Nigeria Institute of Medical Research. We also have testing capacities in Uroa, in Oyo State, in UCH, Oyo State, that's Ibadan, and the Federal Teaching Hospital Abakaliki, and the Africa Center for Excellence in Genomics in Ede. There are other states that are on stream: Kano, Borno, Kaduna, Sokoto. The NCDC supports response activities and preparation in all states through timely deployment of rapid response teams to every outbreak state, and they contribute significantly to improving contact tracing, case management, risk communication, infection prevention, control, and also by providing training, guidelines, and personal protective equipment. Continue to enhance the capacity and understanding of frontline workers for this novel virus. The Federal Ministry of Health's COVID-19 Accreditation Committee is inspecting public and private treatment centers and following strict infectious disease management protocols in order to increase bed capacity for COVID-19 isolation and treatment nationwide and to protect health workers from harm. They will soon start this inspection and accreditation tour to all states, beginning with those with active COVID-19 cases. The bed space expansion starts with our federal tertiary hospitals, who will also be the centers for ICU at the beginning, where separate wings have been reserved and converted for COVID-19 management. Lagos University Teaching Hospital commenced such operation last Monday with a 60-bed isolation center, having received a COVID-19 starter pack and trained healthcare workers. I want to mention here that the Future Assured program of Her Excellency the First Lady has assisted us in locating a treatment center which is currently under renovation at the cadastral zone area. We particularly appreciate that. All designated isolation and treatment centers have adequate supplies to manage cases, and there is no shortage of personal protective equipment. and also no fear of shortage in the short term for health workers. It must be noted that there is a limited supply of consumables in the market due to increased global demand and increased production to public health crisis. We are, however, developing in-country manufacturing capacity. Citizens should use limited supply of this equipment judiciously. And also bear in mind that this should not be a time for hoarding or for price gouging or for making profits. Health workers have priority in rationing of commodities because they are more at risk. Private practitioners have a big role in educating the public and protecting patients and frontline health workers, and by having a high index of suspicion to identify, advise, and swiftly refer suspected cases to designated management facilities for testing and according to NCDC guidelines. However, private facilities must apply to the Federal Ministry of Health for accreditation before engaging in treatment of COVID-19 patients. They also share in the responsibility to maintain essential and emergency service at all times and ensure safe transfer of suspected cases of COVID-19 by dialing the toll-free emergency number 112 or the NCDC toll-free number of 0800 97 000010. I wish to underscore the importance of giving accurate and complete information on symptoms or your travel history to healthcare workers when you are seeking care, so as not to endanger yourself and also endanger the proper diagnosis or put healthcare professionals at risk. I've said before that some persons are continuously giving wrong information in order to mislead healthcare workers. Only the designated treatment centers can provide safe isolation and management of COVID-19 patients, and also to avoid spreading the virus to your family members and to friends and the public. All medical practitioners and healthcare workers, and also the public, are reminded that COVID-19 is such a highly infectious disease that they should abstain from trying to privately treat it and or manage these cases in their homes. They should all, as I say, be referred to healthcare facilities. While the government is encouraged by the commendation from the World Health Organization and the UN, we shall not relax, because we still need to further develop our strategy and sharpen our processes to face the coronavirus challenge, the magnitude of which we cannot yet fully guess. I shall reiterate the importance of everybody observing good respiratory hygiene, hand washing, social distancing, and once again urge Nigerians to obey this stay-at-home order, especially to protect yourself, protect healthcare workers, and follow the guidance of government. Both public and private sector workers must also be reminded to maintain a high index of suspicion and not to treat all cases of cough and catarrh with levity, and to employ infection prevention and control measures and refer all suspected cases to the facilities and visit the website covid19ncdc.gov.ng for updated information, including national case definition guidelines and other advisories. No citizen should be sent away from a private hospital without being given advice. I also want to advise against rumor mongering, which creates needless fear and restiveness in society. All information is provided to the public. Nothing is held in secret. And thank you all very much for listening.